Welcome back to the Trad Nurse Podcast, the show for travel nurses, staff nurses, and anyone who wants to build a smarter, more financially secure nursing career. This is episode 8. I'm Christine, your host, a bedside and travel RN veteran, business owner, and someone who has sat on both sides of the table as a staff nurse and as part of management teams. Today, we are talking about something that's impossible to ignore in 2025, the explosion of nursing strikes across the United States. Over 28 healthcare strikes this year alone. The majority involving registered nurses, and many of the biggest ones are in California. I'm going to be completely transparent with you. As someone who has helped manage people, nurses in particular, I am not a fan of strikes. They disrupt patient care, they stress everyone out, and they cost hospitals and agencies a fortune in contingency planning. But, and this is a big but, I also completely understand why nurses are walking out. The data and the stories coming from the picket lines are impossible to dismiss. So today, I am wearing two hats. The management hat that dislikes seeing OR schedules collapse, and the nurse hat that remembers working overtime because there was literally no one else to do it. My goal is to give you the facts and explain what's really driving these strikes. And most importantly, give you practical advice on what you should do, whether you're thinking about honoring a picket line, crossing one, or just trying to protect your own career in this chaotic environment. Let's dive in. The big picture. Why 2025 has been the year of the strike. 2025 is on track to shatter recent records for nurse strike activity. The two biggest labor actions so far, October 14th through 19th, Kaiser Permanente strike. 31,000 RNs and health professionals across California, Oregon, and Hawaii. When allied unions joined, the number climbed closer to 45,000 workers off of the job. The October 30th one-day strike at 6 Tenet hospitals in California, 3,100 nurses walking out simultaneously. And those are just the headliners. We've seen Prime Healthcare, USC Keck, Stanford, and dozens of smaller labor actions. So what's driving nurses to the point of striking? From everything I've read and from talking to nurses on both sides of the line, it breaks down to 4 non-negotiables. Chronic unsafe staffing. Nurses are being asked to take 6, 7, even 8 patients on med-surg floors, when the evidence says 4 is the maximum for safety. Wages that have not kept pace with inflation, especially in high-cost states like California. Erosion of benefits, higher health premiums, frozen pensions, elimination of retiree health plans, and feeling completely voiceless. Over half of nurses in recent surveys say they have little to no input on policies that directly affect patient care. And here's the part that frustrates management and me when I'm in that role. Many of these systems are sitting on massive cash reserves. Kaiser Permanente had $67.4 billion in reserves at the time of the strike. Tenet made $41 billion in profit the year before. When executives are pulling down 8-figure compensation packages while asking nurses to skip breaks, it's very hard to sell the "we are broke" narrative. So yes, I get why nurses strike. I don't have to like the disruption, but I get it. A lot of you listening right now are travelers or per diem staff, and you are wondering, what does this mean for me? Here's the reality check. Hospitals facing a strike will pay insane crisis rates to keep beds open. We've seen med-surg rates jump to $120 to $150 an hour, and ICU rates north of $180 an hour during strike threats. But, and this is critical, many contracts now contain explicit strike work clauses. Some agencies will void your malpractice insurance or even terminate your contract if you take strike assignments without their permission. So please read the fine print. My advice, if you're offered strike work, clarify it in writing exactly how long the assignment is guaranteed. Make sure you have your own occurrence-based malpractice. Most agency policies exclude strike work. And understand that once emotions cool, some staff nurses remember who crossed the line, and that can affect future local opportunities. I'm not telling you not to take the money. Just go in with your eyes wide open. And another thing I should add, I do know nurses that their assignments have been canceled with no notice. They showed up in California, packed up everything, and were scheduled to work and literally got canceled that day. So you need to make sure your contract is clear before you take any strike assignments. So what nurses should actually do, whether you strike or not, here's the part I really want you to listen to. Striking is a last resort tactic, and it's exhausting. There are smarter, longer lasting ways to create change that don't require you to lose pay or risk discipline. Document everything, every unsafe assignment, every missed break, every violent incident. Put it in writing through your hospital's reporting system. Data is power when regulators or legislators get involved. And always CYA. Get involved in shared governance or your practice council. The hospitals that rarely strike are the ones where nurses actually have a seat in the decision-making table. Support safe staffing legislation at the state level. California already has ratios, and that's why so many strikes, they are about enforcement, not creation. Push your state to follow. Vote with your feet strategically. If your hospital refuses to staff safely, leave for one that does, and tell them exactly why you're leaving in your exit interview. And if you don't have an exit interview, I've noticed some CNOs lately aren't doing exit interviews, and I don't know if that is because they don't want that data, because retention data scares administrators more than almost anything. Build your own financial runway. The single best protection against being forced to work in unsafe conditions is having 6 to 12 months of living expenses saved, or the ability to take a travel contract tomorrow. When you're not financially trapped, you can advocate from a position of strength. Final thoughts. I don't like strikes. I want them to be unnecessary. But until health systems stop treating nursing labor as the first place to cut costs and the last place to invest, they're going to keep happening. My ask to hospital leadership listening right now, fix the root causes: safe staffing, competitive total compensation, and genuine respect. And the picket lines will disappear tomorrow. My ask to nurses, keep advocating, but do it strategically. Sometimes that means walking out, but most of the time it means building power so you never have to. That's it for this episode of the Trad Nurse Podcast. If you are dealing with strike threats at your facility right now, drop me a DM on Instagram at TradNurse, and I'll do my best to give you personalized guidance. Until next time, stay safe, stay paid, and take care of each other out there. You've been listening to the Trad Nurse Podcast. If this episode helped you, please leave us a review. It really does help other nurses find the show. See you next week.